I look, I see. I see a world of beauty. I touch, I feel.
أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم والصلاة والسلام على محمد وعلى أهله وصحبه أجمعين. Thank you so much for inviting me to speak here at the Peace Academy. My specialty is pediatric critical care, so I take care of very sick children from few days of age up until 18 years of age. And so my topic today is going to be on child safety, inshallah, which is an important topic. Many of us have children, and in my specialty we see a lot of injuries and a lot of accidents that can happen that are often preventable with a few safety guidelines. Please feel free to ask any questions if you have any questions, inshallah. And then the brother after me is going to apply some Islamic concepts, I guess, to what I'm saying. The statistics I give you are going to be for the United States here. And first, to talk about safety where we live, in our houses. So in the US, almost 3,000 children die a year from accidents within the home. More than 3 million children are treated annually in emergency departments from falls in the house, accidental poisonings, other simple accidents that happen at home. So alhamdulillah, most of them are not serious things, but they can be, and children can die from some of these accidents. Accidents can be avoided, and a lot of these accident guidelines or safety guidelines are on various websites. One good website is the American Academy of Pediatrics that has a lot of these things that I'm going to speak about clearly described. So some of the things to remember in your house are that there's a lot of dangerous things there, and children, as they're starting to walk, can get into areas that you might not want them to get into. For example, medicines, especially those of us that have grandparents that visit, or the children go and visit grandparents, they might get into the medicines that are laying around. Some of these medicines may not cause much harm. If the child takes 1 or 2 tablets of Tylenol, that may not be a big deal. But if they take medicines that are very potent, very strong, for example, clonidine, 2 or 3 tablets for a little child can cause significant injury, hypotension, lethargy, and they can actually stop breathing. So medicines should be locked up. Medicines shouldn't be left laying around. The child-proof caps, older children, 3-year-olds, 4-year-olds even, they know how to open them, even though sometimes us as adults, we don't know how to open the bottle. They should be put away in the medicine cabinet, put out of reach. If the child goes and visits relatives that are sick or elderly that have a lot of medicines, those medicines should be put away as well in that house. So it's not enough just to make your home safe, but another home or house that a child is going to that has a lot of medicines, that needs to be made safe as well. Liquids, fluids, the same thing. We used to see in the past a lot of children who have accidentally swallowed or drank antifreeze, right? The antifreeze that you put in your radiator in the car before we had the child safety caps. The liquid smells sweet, it's bright, it's shiny. Alaikum assalam wa rahmatullahi wa barakatuh. And if it's left in containers that are not child-proof, say in just a regular bottle in the garage or underneath the sink, then the child may look at it, think it's some kind of juice, and they start drinking it, and before they realize that it doesn't taste good, they've swallowed quite a bit of the antifreeze. And antifreeze can cause damage to the kidneys, it can cause damage to the heart, it can be a serious poison that can cause death. So different liquids. What are the kind of liquids that we keep in the house? Like Clorox, bleach, window cleaner, those kind of things. Those are the dangerous things. Liquids that we use in our yards. So insecticides, pesticides, maybe gasoline, kerosene, those things, again, they need to be securely placed, locked up, or put in bottles that are not accessible to the child. Some other areas of danger, there was a time period until it became mandatory that on blinds, blinds, how you open them with a rope. I saw many children that were strangled and suffocated from these ropes, that they start playing with them, it gets wrapped around their head, and they're not able to get their head out of the rope, and they stop breathing, and then they go into cardiac arrest. So now these ropes that open or close blinds have to be either secured, so tied down, or they can't be a loop. They have to be two separate strings so that it doesn't get into a circle around the child's neck. And these things, subhanAllah, they happen almost all the time. Just this last weekend, we were at a friend's house, and one of the girls took a rope that was for curtains and put it on her head and wrapped it around her neck. Alhamdulillah, nothing happened. The father recognized it and took it off. But these accidents can happen very, very easily. Second story windows. Children jumping around. MashaAllah, most Muslim children are very active and a little on the wild side. And so they are jumping around, taking risks. And sometimes these windows, though they have a screen on them, are not strong enough if the child is jumping close to the window to prevent them from falling out. And just falling from a second story window, even though you think it's not that high, a child can suffer a serious head injury. Typically children, because their heads are bigger than their body in comparison to an adult or a teenager, often the first point of impact is going to be their head when they're falling. So almost 70% of children that are involved in motor vehicle accidents or falls will have some type of head injury. So the windows should be locked, or they should have latches up at the top so the child can't open the window. The screen itself is not going to be strong enough to have them not fall through the window. Keep furniture away from the second story window so that the child can't climb up onto the table or the chair and get out and fall from the window. Electrical outlets, also another fascinating thing for children, right? They like to stick things. I remember as a child myself sticking things in the electrical outlet and sometimes getting shocked, or even to the point of putting it in and seeing the metal get red hot and start melting. Okay? Kids do all kinds of things. So covering the electrical outlets. I remember a friend of mine who pulled an electric cord out with his mouth. And the mouth, when he pulled it out, as he was pulling out with his teeth, he ended up getting burned, and a severe electrical burn on the side of his mouth because he was chewing on it and pulling it out. Cabinets, doors can have child-proof locks on them if there's fluids or chemicals that are there. Many of us have swimming pools, which I'm going to get into the swimming pool safety as well, but the chemicals used to clean the pool or to keep the pool water clean, that can also be very, very dangerous. So those need to be locked up as well. Even children's toys in the house, the toys can be dangerous, especially if they're throwing them at each other or they're jumping around and maybe a sharp object or a toy that has a sharp edge. The child falls on it, it can cut their face. It's true what our mothers tell us, not to run with some scissors or pencils or pens. We have seen children that have been running with a lollipop or a pencil, and the pencil going into the back of the throat and actually hitting, for the doctors that are here, the internal carotid artery from the inside and causing a stroke on the child. So hitting a big blood vessel by going on the inside of the throat into the blood vessel and causing a stroke. So they shouldn't be running with sharp objects, playing with knives, and any toys that have any sharp edges. Those should be either removed, or you make sure that the child isn't using it in a dangerous manner. Alaikum salam wa rahmatullahi wa barakatuh. Playground equipment, same thing. Usually when the playground is first installed in the house, it's safe. And then over time, the kid's jumping, swinging, it starts getting loose, and now it becomes less safe. So periodically checking, making sure that all the screws and the nuts and bolts on the playground equipment are solid so that it's not going to fall apart when the child is swinging or going down the slide. And if there's an age limit, if the playground equipment is only supposed to be for children up to 12 or less, then that should be adhered to. So a 15-year-old or a 16-year-old shouldn't be jumping on it and swinging on it, because that's just going to weaken the structure, and then when the little child plays on it, then they'll have more risk of falling or the whole thing collapsing on them while they are playing. Because there is danger of poisoning or swallowing anything, every household should have the regional poison control center number up on the refrigerator, so that if your child swallows something or eats something and you're not sure, is it dangerous or is it not, you can call this number. It's 24 hours. Someone will answer you, and you can say, hey, my child took 2 tablets of aspirin or 3 tablets of clonidine, what do you think I should do? And they'll be able to give you advice. Oh, it's okay, don't worry about it. Or, well, if you start seeing these symptoms, you need to go to the emergency department. Or, this is a very dangerous medicine, you should take your child to the emergency department immediately. Or if it's serious enough that whatever medicine they've taken and now they're having a seizure or they've collapsed, then obviously you call 911. It used to be recommended to always keep some syrup of ipecac, which is a medicine that will make the child vomit, but the recommendation now is not to do that. This medicine is very, very potent and very strong, and some children that were given this medicine, they vomit so severely. The whole premise behind this was that if a child swallowed something, you give the syrup of ipecac, and it causes them to vomit out the medication so that it doesn't have time to be absorbed in the body. The reality is that this, again, so potent that the vomiting, being incredibly severe, can actually cause internal damage. So there can be esophageal tears, rupture of the stomach. If the medicine that the child has swallowed is going to make them a little bit sleepy, now they're vomiting as they're getting unconscious, so they might aspirate or inhale some of the medication. And then there are some medicines or agents such as gasoline or the antifreeze that you don't want them to vomit again, because it causes more damage on the way out. So hydrocarbons, for example, can cause a chemical pneumonitis by inhaling the fumes. So once they've swallowed it, you actually want to leave it there. Don't have them vomit more, because that can cause more damage by the fumes being inhaled. So it's not recommended anymore to use the syrup of ipecac, but if you have a concern that your child swallowed something and it might be dangerous, call the poison control center or take them to the closest emergency department, and then you can get guidance on what to do next. Baby walkers, those aren't sold as much anymore. The baby walkers, the round ones that the child used to be able to crawl around in, those now are considered to be pretty dangerous. The child is running, and the edges, they can run and smash their fingers on the side of the wall with the walker. Or if the walker is upstairs or near some stairs, they can go running in the walker and then topple over and again fall or roll on the stairs. So baby walkers are considered to be avoided now. And just the little baby jumpers, the ones that are stationary, where you can put the baby in it and it can jump up and down, but it doesn't move around in the house. If the child is up at the second floor, or there are stairs where they're playing, there should be gates, safe gates, so that it's secure and it's latched and high enough that the child won't crawl over it, so that the child doesn't end up crawling or falling or rolling down the stairs as they're moving around the house. Playpens or the crib, the baby crib. Now it's highly recommended that the bedding situation almost be like in the military, that the bed be smooth, flat, not a lot of toys and blankets and pillows, because the child, while they're sleeping, may roll a particular way, especially a baby, and one of the big stuffed animals that looks very cute can end up falling on their face or falling over their head and actually suffocate them. And again, we've seen children that have suffocated from being in a playpen or in their crib, and one of the blankets getting wrapped around their head, or the stuffed animal falling on top of their head, and they're too small, they can't get their head from underneath, and they suffer from suffocation. Sleeping with parents or sleeping in the same bed as parents. This is a common practice in many cultures, including our cultures, but it can have dangers as well. And sometimes we will see children that parents are maybe very heavy sleepers, and the baby, for example, was brought in for the mom to breastfeed. Mom's exhausted, dad's exhausted, and a few hours later one of the parents wakes up and they find that they have laid and slept on top of the baby. Okay, and now the baby has suffocated or even gone into cardiac arrest from lack of oxygen. So if your child is going to sleep with you, you should try to stay awake, or at least there's a lot of distance so that you're not going to roll on top of them by accident, especially people that are very, very deep, heavy sleepers. And especially people that may have obstructive sleep apnea, where they stop breathing themselves when they sleep because their sleep pattern can be somewhat abnormal. And those that are kind of on the heavy side as well. There's more likelihood that that accident might happen. If there's two beds that are put together, say two twin beds, sometimes the child, if it's laid on one of the beds, can roll over and fall into that crack between the two mattresses, and they can't get out and they can suffocate. Or if the bed is put close to the wall but there's still a little bit of a space, it's not, the mattress isn't all the way up against the wall, the child can fall into that space as well and get trapped and not be able to breathe. That's another reason a lot of the cribs nowadays also, there are certain safety codes that have to be met. The mattress in the crib has to go all the way up to the sides. There can't be any way that anything can get caught on the sides. There has to be a certain distance between the wood slates on the side of the crib. So not so big that the child can get their head stuck in it, but big enough that there can be good circulation. And even then, many times there will be recalls of some of these beds or toys or devices. When my children were young, I used to frequently check on Consumer Reports or safety alerts for any recalls that might happen with certain toys or with certain cribs. Because sometimes initially it may be thought to be safe, and then they find out that so many children have been injured from a piece of a toy flying off and going into their eye, or something being the matter with the bed, and some child end up dying, so that you make sure that you're not putting your children at risk. So the stuffed animals and the blankets, those can be very, very dangerous. And then for babies, specifically with SIDS, I'm sure some of you have heard sudden infant death syndrome, children that for some reason just die, babies that just die in their infancy. Not sure exactly why it happens. Lots of research going on to see how this can be prevented. Some of the research has identified that sleeping on the back seems to lower the incidence, so it's safer for the baby to sleep on its back. Also, smoking around the house by the parent or anybody else in the house increases the risk of SIDS or sudden infant death. So minimizing any smoke exposure, and not even just smoking in the house necessarily, but a parent that smokes and the Shamel Abd-Allah, and the smoke odor is in the clothes, that can cause an increased risk of sudden death or sudden infant death syndrome in babies. Same thing, having the mattress be firm and flat, not a lot of bedding. There's some hypotheses that the child is an excessively deep sleeper, and while they're sleeping and they don't roll, that around the head, around the mouth, high levels of carbon dioxide develop, and if there's a little bit of a depression in the bed, if it's very, very soft in the mattress, carbon dioxide is heavier than air, and so maybe a cloud of carbon dioxide builds up around the baby's face, and their oxygen levels drop, and then somehow they're triggered to go into this sudden infant death syndrome. But the main recommendations is the back to sleep program, which is having the baby sleep on its back. That's supposed to drop the incidence by 50%. Every child is going to be different. Some of my children were able to sleep on their backs, and some of them were just very fussy and very irritable and colicky, and the only way we could get to sleep is to put them to sleep on their stomach. So it's going to be dependent on the particular child. Water safety, pools, right? We all live here in Southern California, and a lot of us have swimming pools. I would not have a swimming pool in my house because I saw too many children die in the pediatric ICU from drowning accidents. Okay, these are terrible tragedies. A healthy child that within a few minutes of just the parent not knowing where the child is now falls into the water, and we think like an adult or an older child, a teenager, that there's going to be a lot of noise, that the child is going to scream and yell. But a 2-year-old or an 18-month-old, they're actually not going to make that much noise. They will fall into the water and slowly sink, and there'll be no noise, so it's silent. Okay, so they fall into the water, they can't float up, and gradually the body is depleted of oxygen. And as the oxygen reserves go lower and lower, the heart rate slows down till eventually, with minimal oxygen in the body, the heart will stop. And the longer the heart is stopped, the more organs are going to be damaged. And the organ that is the most susceptible to this type of injury, or any suffocation injury, is going to be the brain. Okay? So a lot of these children, even though they're found and pulled out of the water and resuscitated, suffer severe neurologic injury, and their brains are severely damaged to the point maybe of becoming brain dead, where there's absolutely no brain function, or to be in a persistent vegetative state where they can't speak, they can't walk, they're not able to move anymore, and now they're bedridden, which is obviously a major tragedy. And this is a child that just a few days ago was healthy, running around, and a joy to the family. So water safety is incredibly important. Drowning is the second leading cause of accident-related deaths for children 1 through 14 years of age. In 18 states, for children less than 5 years of age, drowning is one of the top causes of death. And California is one of those 18 states because we have so many swimming pools. Boys are more likely to drown than girls, and you can imagine the child that is kind of semi out of control, crazy, jumping around, playing, the typical Muslim boy, is going to be more at risk versus the child that stays holding on to mother or father and doesn't like to take risks and doesn't go and explore on their own. So children that are more risk takers, those are the ones that are going to just run and jump into the pool, not really understanding the consequences. Now again, just a few safety tips can significantly reduce the potential tragedy of the near drowning child. So whenever any children are around any body of water, there must be an adult watching. Okay, so people will have pool parties or birthday parties where there's a lot of children running around, and there's a lot of parents, and surprisingly that is often the time when the drowning accident will occur, because everybody assumes, you know, I think Nahed is watching my child, he thinks I'm watching his children, and in the end nobody's watching them. Okay, and before you know it, one of the children have fallen into the water. We said it's silent, nobody knows until somebody starts realizing, hey, where's my son or where's my daughter? And then you realize that they're at the bottom of the pool. So someone who is dedicated to watching them in the water has to be vigilant and like a lifeguard. Okay, they shouldn't be talking to anyone, they shouldn't be getting on the phone. If it's a non-Muslim family or gathering, They shouldn't be drinking. There should be no alcohol. There shouldn't be any drugs. Okay? They have to be completely focused on the children and what's happening around the water. Even a few minutes. There's statistics that show that most of the families that have a child suffer a drowning accident, it was less than 5 minutes that they lost track of their child. Okay? So it can happen very quickly, very, very quickly, especially if there's a lot of kids. Okay? You can't keep track of every one of the children every single minute of the day. And it's often when you go visit somewhere where, again, the safety is not as stringent or as strict. We have sad stories of the parents going to visit grandparents, and maybe the grandparents have a jacuzzi or a pool, and they don't have the safety precautions. They don't have the pool barrier, right? In California, it's a law that there has to be a barrier around the pool, 5 feet high. It has to fully encircle the pool. It can be the house, okay? It can be the house as one side of that enclosure. But if it is the house, there has to be alarms on the windows and on the doors, so that if the door is opened, an alarm goes off, and hopefully the parent will realize that the child has opened the door and could be going into the pool. But like Dr. Hassaniya said, yes, going to a house that's not as safe, that might be where the risk is going to be higher. And even grandparents.
Only in swimming pool?
It's not only in swimming pools. And
What if you go to the beach outside?
that's right, the same thing. For older children, it can be in the lake, it can be at the ocean, can be at the river. But for toddlers in California, it's mainly the swimming pool. But it can also be in a bathtub. It can be in a bucket of water. It can be the toilet, okay? The whole child doesn't have to fall under the water. So say it's a 6-month-old that's in the bathtub getting a bath, and mom has the phone ring and goes to answer the phone, and the little baby's playing in the water, and 5 minutes later they come back into the bathtub and the child is laying, has fallen over and is laying now face in the water. It only takes a few inches, just a few inches of water. The face is fully covered and now the child has the drowning. Okay? It doesn't have to be the whole body. So infants in bathtubs, babies that are just starting to walk, leaning over and maybe even falling headfirst into the toilet, okay, and now they can't get out, or a bucket of water. So it doesn't take that much water for the child to drown in. They topple over into the bucket and now they can't get out. And then you find them after they've already gone into cardiac arrest. Children that have seizures, that have epilepsy or some type of seizure disorder, they should never be left in the bathtub or left swimming alone without adult supervision, because potentially they could have a seizure while they're in the water. And then if they have the seizure while in the water, then they could suffer the drowning accident. There are certain types of heart conditions as well, that the heart rhythm is abnormal. And with the heart rhythm being abnormal, the child can faint. And so children that have those types of dysrhythmias or abnormal heart rhythms, they also should never be left in water alone, even when they're older and they know how to swim, because they might have that rhythm problem occur while they're in the water, and then they pass out or faint, and then they can drown. So there needs to be constant supervision. The children, even when they're older, should never swim alone. If they're at the ocean or the beach or at a lake, there should be a friend with them. There should not be around our homes buckets with water. You know, you can have children, unfortunately, drown in buckets of gasoline. So for some reason, there's a bucket of gasoline or a bucket of Clorox that's kept around the house. And not only now is the child going to drown, but also have the chemical injury from that agent or whatever it is that's in the bucket. The pool should be free of any toys around the pool area, so that a little kid wanting to go get the toy, runs to the toy and happens to be too close to the water and falls in the water. The skimmers or the cleaning, those automatic machines that clean the pool, some of them are created to look like boats or look like some other type of fancy toy. And if the child is interested in it, they may go and try to get into the water to get that toy. So the cleaning machine shouldn't look like any toys. This is one of the advices of the Prophet ﷺ: teach your children how to swim. So the earlier you teach them how to swim, which includes pool safety, hopefully the less risk there will be of the child drowning in any water. But especially for a smaller child, maybe up until their teenage years, just because they have swimming lessons doesn't mean that they still can't drown. Okay? A child who is just starting to swim may also take risks. Their older brothers are jumping off the diving board or swimming in the deep section, or their older sisters, and they think they can do the same and they can't, and then they sink down to the bottom of the water. So encourage learning to swim, but be cautious, because just by the fact that they think they can swim doesn't mean that they're going to be safe. Now, if this accident happens, and it's going to happen, okay, there will be times when children will fall into the pool accidentally. Again, there are some rules to follow that may be helpful. The most important thing to prevent the brain injury that happens with the drowning accident, and if the heart should stop or they stop breathing, is to have them start breathing again and have the heart start beating again as quickly as possible. Minutes and seconds count. So anyone who has children or takes care of children really should know how to do CPR, even just basic CPR. Okay? There are studies that show that just bystander CPR that started, even though it may not be that effective or the most perfect CPR for someone who's had a cardiac arrest, can significantly reduce the sequela or the complications, okay, versus doing no CPR at all. All right? So bystander CPR right when the accident happens is so important and can help prevent the brain damage. So I talked about the child falls in the water, the oxygen levels getting lower and lower until the heart stops, and now brain cells starting to die. So the quicker you get the child out of the water, or get them out of the bathtub, or pull their head out of the toilet, and get them to start breathing again, you can lessen the damage, lessen them dying, and lessen the brain injury that might occur. Okay?
Like upside down, like this?
CPR, I mean, that's a whole different lecture, and I'm not going to get into that. So everyone has a YMCA or American Heart Association where you can learn how to do CPR and get your basic CPR provider card. And I encourage all of you to get it. Many years ago at the masjid, during the khutbah prayer, a man collapsed, and myself and Dr. Hashmi started doing CPR on this man. And later on he ended up dying. He had suffered a major stroke. Okay, so you don't know. You have no idea when someone isn't going to collapse in front of you, and CPR might be helpful. So for the child, it's recommended that if you do lose track of your child and you have a swimming pool, the first place you should check is the pool. Okay, not the last place, because if they have fallen into the pool, the quicker you get them out, the better the outcome is going to be. So if they've only been in the pool for 1 minute, 2 minutes, the likelihood is that when you pull them out, or that maybe they're not breathing but the heart hasn't stopped, you start doing some rescue breaths, now they start coughing, and now they're starting to breathe, okay? Versus you go and check in the bathroom, you go check upstairs, you go check in the garage, and finally you go check in the pool and you find them down at the bottom of the pool. And it's been now 10 minutes and the heart has stopped, and now the CPR is not successful, okay? So if you lose track of your child, check the pool first. And like I said, they should never be left in the bathtub alone. They shouldn't be left in the pool alone, so that you can try to prevent this injury. If they fall into the pool and they stop breathing, CPR immediately. Immediate CPR can make a huge difference. So call 911. So it's also recommended that any pool area should have a phone readily available so that you can call immediately and then start your resuscitation. Get them out of the water. If you're not able to get them out of the water, you can start the rescue breathing even in the water. Okay, so if they're too heavy or for whatever reason you can't get them out of the water, hold them up as best you can and start the rescue breathing inside the water. Okay, and CPR if you think that their heart is stopped. It's okay to do the chest compressions even if you don't know if the heart is stopped or not. Hopefully you've called 911 and the paramedics or firefighters are going to get there, and then they can assess and see if the heart has truly stopped beating or not. And the new CPR guidelines have changed. It used to be ABC. Now, does anybody know what it is? CAB. So it's compressions first and then airway and breathing, okay, for all ages. So the thought is that just doing a few chest compressions right off from the beginning, instead of wasting time and trying to do some breaths, maybe some chest compressions right from the beginning can help the heart start beating again, and then you do the rescue breathing if they're not breathing. Okay, so learn CPR. Those little floaty things that you put on the sleeves, those are not safety tested. They are not recommended by any of the agencies that make life preservers and flotation jackets. Okay, those things are notorious. Okay, a lot of times they don't even fit on the child that well. Okay, they're very loose. The child gets into the water, it gets wet, their arms easily slide out. So if you're going to use any type of flotation device for the child, make sure that it is something that's approved by different agencies. And usually it's going to be a complete vest that covers the whole chest. Maybe it's zipped up or it's pulled over the head. But these floaty things, those are not safe. Neither are the rings, right? The little life preserver rings that you blow the air up. It's very easy for the child to let go and sink. So that's not considered safe either.
So the swimming pool, if you don't mind, I saw a video clip from a long time ago. It said very easy to woman to deliver the baby in the swimming pool. And you're showing this in the video clip, YouTube. The baby going out and it's outside the room and stuff. Is that normal?
I've heard of that, of women delivering in the water. Well, I would imagine they have to get the baby out of the water pretty quickly, otherwise they're going to suffocate as well. So
you have to be swimming.
That's right, that's right. So if you're going to use swimming aids, make sure that they are approved. And remember that even with those swimming aids, the child still can drown. Okay, they turn around, they flip upside down. It's not 100% foolproof. Now, the pool itself, if there's any gates to get into the pool, the latches and the locks should be on the inside of the pool, not the outside. Okay, we know that the children are very intelligent. You know, our 6-year-olds know how to program the remote control better than we can, right? They're very intelligent. They're very manipulative. So if the latch is on the outside, one of them will figure out how to open it, and they will get in, even though you think it's some sophisticated lock, or they'll find the key, or maybe your teenager will open the lock and forget to close it, and then the child just has to come and pull something open and they get in. So the lock should be on the inside, the pool side, and nothing on the outside. If they do fall in the water again and you initiate CPR, don't forget to call 911 as quickly as possible. That's what they're here for. We have the benefit here in Southern California, except some areas, maybe Paris, Nuevo, some of those remote areas. It may take the paramedics quite a bit of time to get there. It may take them 10 minutes to get to your house. Okay, so not doing CPR. There's the tragic stories of the child being pulled out of the water, the parents saying they're still breathing, but then they stop breathing and nobody does anything because they're waiting for the paramedics to get there. Okay, and the paramedics don't get there till 10 minutes later. So a child like that could have benefited from immediate CPR being done until the paramedics get there. So don't hesitate to call 911. Obviously, if you're at the ocean or at a lake, there's going to be more risks with waves and currents. And so be careful, even for adults, to not get out of your safety zone. Okay. So pools, very dangerous, and this is a tragic, tragic accident that can happen. One of the top causes of death for children under 5 in the state of California. So be very careful with your pools. Bicycles, another toy that can be fatal. So, you know, my boys, it's very difficult to get them to wear their helmets, and they're just running down the street with the bicycles and running into the street. But the reality is that children can be killed from bicycle accidents. About 250 children ages 14 and under are killed in bicycle-related accidents every year. 90% of bicycle-related deaths are the result of collisions with motor vehicles. So even though we think it's in a residential neighborhood and the cars are going slow, we know, because we don't always drive at 25 miles an hour, right, in the residential area. So a car is going 35, 40, little kid runs out with their bicycle and bam, they get hit, okay? So these accidents will definitely happen. Children between the ages of 5 and 14 have a death rate more than 2 times the death rate of all other bicycle riders. So again, some of the basics. They shouldn't be just rushing out into the street, okay? They should be riding on the sidewalk, maybe on a bike path. They should be supervised. They should be wearing a helmet because, as I said earlier, in motor vehicle accidents and in falls, because of children and the way their body weight is distributed and their body mass, the head is often one of the first points of impact. So wearing a helmet is so important. Recently we had a child in the ICU that was riding their bicycle, and the chain all of a sudden locked up, and so the child flipped. So there was no car, didn't hit anything, just the chain got tangled, and the child flipped over, hit his head, and he suffered an epidural hematoma, which is a bleed inside the brain, okay, just from falling off the bike. So wearing a helmet, make sure the helmet fits properly, make sure it seats properly. It should fit equally. There should be the parts of the helmet sticking out in the front of the back. They shouldn't be wearing it so that it's just on the back of the head and the forehead is unprotected. Okay, so make sure it fits appropriately. The straps should be tight. They don't like it. It makes them sweaty. They just don't want to wear it, but it may save their life. If they happen to be riding at night or even during the day, they should wear bright colored clothing. If they're riding their bicycles at night, there should be something shiny on the clothing so that if a car is coming, they'll be able to see it. Ride only with adult supervision for very young children. Ride with the flow of traffic, not against it. Ride on the sidewalk. Be aware of surroundings. Watch the traffic. Always look right and left. Make sure the bike fits the child properly. You know, you have a bunch of kids and the teenagers have their bike and the little kids have their bike, and the little kids, they always want to ride their older brother's bike. They barely can, and they get on it and they're wobbly and they can't even put their feet down, and so they have a more likelihood of crashing. So the bike should be so that when they stand over the bar, their feet can be flat on the ground. Okay? If their feet can't touch the ground, they're going to have more risk having some kind of accident happen. Make sure and check the brakes. The brakes on the bikes can become loose, especially if the boys are into you know, the bike skidding and going on really ramming hard on the brakes so they can get a good skid mark, right? This guy's smiling. He probably did that when he was younger. So that burns through the brakes more quickly, and now the brakes aren't really going to work when they really need to stop. So bicycle safety, same thing is going to apply with skateboards, with roller skates, roller blades, those types of toys. Not only should there be a helmet, but there should be wrist guards, there should be elbow guards, knee guards, because just falling on the wrist, fractures can often occur. If they're in the skate parks where, you know, the kids are jumping with their bikes and skateboards and doing all kinds of extreme things, then it's even more important to have these protective pads on them. Fire safety. The U.S. has one of the highest fire death rates in the industrialized world. In the 90s, an average of 4,000 Americans lost their lives and another 25,000 were injured annually as a result of fire. Each year, fire kills more Americans than all natural disasters combined. Fire is the third leading cause of accidental death in the home, and at least 80% of all fire deaths occur in residences, so in our homes. Okay, so fire is also something to be aware of. What's the most common cause of a fire in homes? Who knows? Not the stove. Nope. Nope. The dryer. The dryer. So the dryer not being cleaned properly, the filter being blocked, and the heat building up till something catches flames. So the dryer is one of the top causes of fires occurring in homes. And we actually there was someone in Riverside many years ago that had a fire in his house, and it was from the dryer. So fires can happen. All the other things that you guys talked about also, the stove, the oven, those are also areas or causes of the fires as well. So how can we make it safe for our children? So they shouldn't be playing with matches. They shouldn't be playing with the stove. They shouldn't be playing with the oven. They shouldn't be playing with lighters, flares, fireworks, gasoline cans. Keep matches, lighters, gasoline, and other flammable materials out of sight and out of reach of the children. Children will do anything, okay? So start playing with the matches, trying to blow things up, fireworks. I remember as a child here in the Inland Empire, lots of children, when they didn't have the strict firework codes, burning their whole hand or burning their face or burning their eyes, okay, from these fireworks or firecrackers going off without them being able to control it. Make sure there's a fire extinguisher in your house, preferably one in the kitchen and one in the garage. Make sure that it's appropriate rating and that you periodically test it, okay, because after 6 months to a year, some of them will lose their pressure and they won't be effective. Make sure there are smoke detectors in your house, right? The fire starts in the house, everybody's sleeping, the smoke builds up, the carbon monoxide, and now people are sleeping and they can't wake up and they die in their beds without ever waking up because of the carbon monoxide buildup and the smoke buildup in the house. So smoke detectors, testing them monthly, replacing the batteries at least once a year so you make sure that they're effective. Plan and practice fire escape routes in your house with your children. So if a fire happens, this is what I want you to do. This is where I want you to go. This is how I want you to get out of the house. Never leave small children alone in the kitchen or the home or with access to any type of fire or the stove. Burns also happen right in the kitchen, and it's tragic when you see children that, you know, little child that's starting to walk and goes and reaches up on the stove and pulls down a big boiling pot of pasta or a boiling pot of soup, right? And it falls on their face, falls on their head, and they get severe burns because their skin has been scalded. So don't leave them unattended in the kitchen if something is on the stove. If you're using the stove, try to always use the back burners, okay, the back, so that the child can't pull anything down. And if there's handles on the pots and pans, they should be towards the back, not sticking out where the child might reach up and pull it onto themselves. Fireplaces, okay, it gets cold enough sometimes here in Southern California that we use fireplaces, so there should be safety around that. Same thing, you don't want the child crawling into the fire, or if the wood pops and an ember or a piece of burning wood flies out, it doesn't affect the child. The water heater, if it's put on real high, 180 degrees, 160, that scalding water can burn a child if they're not aware of it and they keep their hand in it for an extended period of time. So lowering the water heater to 120 degrees, okay? Making sure again that the children aren't playing near the water. In the bathroom, always test the water temperature before placing the child in the bathtub. Place one hand in the water with fingers wide and move it back and forth for several seconds, checking for hot spots. Sometimes, you know, maybe the water's a little cool here, but in this section it's really, really hot, okay? And it can burn the child. Never touch electrical appliances or cords with wet hands, okay? Don't reach for radios, telephones, or hair dryers while in the bath or the shower. There shouldn't be these types of electrical devices near the bath or the shower where there are little kids, okay, when they're taking their bath or their shower. Unplug appliances when they're not being used, because that can prevent maybe some short circuit from happening. Unplug any appliance that smokes or smells as if it's burning, and then have it repaired or replace it. Don't use electrical devices that have frayed electrical cords, that the plastic is broken and some of the wires are sticking out. Those should not be used. It's a fire hazard and also a shock hazard potentially for the child as well if they're pulling it or playing with it. And don't overload extension cords or run them under rugs, because again the heat can build up and the fire can occur. And don't forget to periodically check your dryer, you know, where the dryer hooks up into the vent that goes outside of the house. That should be periodically disconnected and cleaned so that there isn't a lot of the dust filled up in it. The dryer itself, make sure and always change the filter when you put in a new set of clothing to be dried, because the heat buildup can be tremendous, okay, in the dryer itself. And then maybe as we're closing, the last, car safety, okay, car safety, infant seats and toddler seats, very, very important as well. So we see a lot of children that are involved in motor vehicle accidents and suffer horrible injuries because they're not wearing a seat belt, they're not in a booster seat, they're in an inappropriate seat belt. So a 2-year-old that's in a car and just with a lap belt with no booster seat, right? The car gets into a major accident. They can still suffer a head injury because their head has been thrown forward. Maybe they hit the front of the seat. And the trauma from the seat belt can be severe enough that it can cause liver damage, spleen damage, and they can actually bleed to death from the seat belt being on a higher part of their stomach where it's not supposed to be. So the seat belt should be shoulder strap, should be right across the clavicle, not across the neck. They can suffocate or suffer cervical spine fracture if they get in an accident and their neck slams up against the seat belt. So it should be over the shoulder, and the lap belt should be down at the lower part of the pelvis. Okay, so it should be down here, not up across the belly button. That's the purpose of the booster seat, to lift the child up a little bit if you're going to be using the regular seat belt, so that the lap belt sits lower down. And then you can adjust the shoulder strap so that it's sitting across the collarbone or the clavicle, okay? And then for smaller children, the safest spot in the car is in the back seat and rear facing, okay? In the child safety seat where it's turned the other way, so that if something is hit, the impact is going to be on the chair, right? Not on the child itself. So there's all kinds of weights and which one do you use for a particular weight and particular height. You can easily find that information out on the internet. Many hospitals, Loma Linda included, or fire departments or police departments have days during the year where you can go and take your car seat and they can show you, or you can demonstrate to them how you're putting the child in the seat, and they can let you know if you're doing it safely or not. Some of them are pretty complex, and you may think you're doing it properly and you're really not. So to go to one of these training sessions, I think is also helpful, so that you make sure that you're putting the car seat in the car properly.
We have another situation for the car safety.
Mm-hmm.
This has happened really tragedy. Our brother from Palestinian, his uncle came to visit, the way for the car. So he go all the way down, visit. When he go out, the kids play.
That's right.
The drive way is close from the grass, so the baby, he back up. He
Very
don't
true.
pay attention,
Yes.
and he killed.
Excellent point. Yes.
He arrested him, and this was big tragedy.
Yep. So I've seen that many times, unfortunately. This accident where a parent or a visitor or a grandparent is pulling out of the driveway of the car and isn't able to see behind them, and it's a little 2-year-old or a baby that's crawling and running over literally the child. We had a poor grandmother that ran over her grandchild, and the child ended up dying, and she did it accidentally. She couldn't see the child. So that's why a lot of cars now will have a rear view TV display so you can see what's behind you. For me, I would not back up the car unless all the kids were in front of me and I could see them. And unless I couldn't see them, I wouldn't back the car up.
And
Okay?
the neighbor also
The neighbor too, that's right. But these are accidents, unfortunately. I mean, these are tragic accidents that can be devastating. I'm sure it was devastating for this Palestinian man.
Arrested, I think
Yeah.
He was very sad for
Of course.
We're going to take just 10 minutes for question, inshallah.
Yes. So last thing, really quickly, internet safety. Okay, internet safety. We're now in the technology age and multimedia, Facebook, Twitter, God knows what else, and just, you know, these things are also dangerous for the children, especially the young teenagers that are just starting to explore, and terrible things happening with these types of media services. So explain to your children they shouldn't give out any personal information. They shouldn't give out their address, their full name to a site or someone on the internet or on Facebook or whatever that they don't really know who it is. Many times there are people that they, on a game site, for example, that you think it's a 9-year-old and it turns out to be, it's actually a 40-year-old child molester. And this is the way they find victims, okay? Hey, my name is Johnny, let's meet at Baskin Robbins and get an ice cream together, okay? And then something terrible happens. So don't give out information. Don't give out where you go to school. Don't give out your telephone number. If you come across a site or a website that makes you feel uncomfortable, you should come and speak to your mom and dad. Never agree to meet someone that you've met on the internet unless you tell your parents, okay? Never send a person your picture without first checking with your parents, right? Facebook is a nightmare, okay? A lot of people are using it, but there are a lot of horrible things that happen with these sites. Don't respond to any messages that seem weird or asking for strange things. Talk with your parents so that you can set up rules. How much time you spend online. Are you allowed to be online without your parents being there, right? The internet, you can access anything, okay? Pornography, very easy to access. All this stuff is happening in the Muslim community. If we don't recognize that, then our heads are going to be in the sand. It's happening to our teenagers, it's happening to our daughters, it's happening to the men in the community. The internet has a lot of bad stuff on it, and it's very easy to get on it. And the bad thing about it is that you can do it in your home in privacy. Nobody's watching. Obviously, we know that Allah is watching, but for many people, that's not enough of a negative to prevent them from doing that. So these temptations are very, very easy to fall into. For parents, having protection on the computer, filters, monitoring what they're doing, periodically checking their Facebook, checking their text messages on the cell phone, who they're talking to, checking the websites that they're getting onto, and just being aware. So this is very important. If you come upon anything that looks like it's child pornography, then authorities should be immediately contacted, okay? Because again, horrible things can happen. Now, that doesn't mean that we're not going to use the internet. It's impossible not to use the internet in this day and age. And Facebook and all these other things are almost becoming required in many areas, including the children's schools. So monitoring and just making sure that they're being safe so that you can prevent a lot of these things from happening. So I know I covered a lot of stuff. There's even more stuff, but let's stop here and I'll answer any questions.
Thank you very much, first of all. And second, we're going to need, inshallah, another time explain the dangers, like you say, the temptation or the manner and the character. Sister and brother is sleep in the same bed when you grow up little bed, like 8, 9 years old. Stuff like protection from TV and the internet. This you need another focus,
inshallah. And I'm happy to. I also give a sex education talk to teenagers and young kids. Again, I think sometimes these things aren't things that we typically talk about with our children. Again, putting your head in the sand, it's not going to go away. It is happening. Teenage pregnancies, drugs, it's happening amongst the Muslim children as well. So we need to talk about it. So if you want me to ever come speak to the children.
We do this. We invited also the teenagers, our society, inshallah, to meet.
Inshallah.
Be with us. So if anyone you need ask a question?
Yes.
Just one thing I wanted to mention regarding the internet. There are wonderful monitoring software.
Yes.
That can be installed in the computer and you can access those accounts from anywhere.
That's right.
So I just wanted to.
Yes. So there are a lot of good software programs that will help block a lot of these sites. And I encourage everyone to install them in their homes, and you can rate it, for different age groups and what sites you want to be blocked, but still also monitor. And don't.
Blocking. I'm not talking about blocking. So if you install those softwares, those invisible softwares, and basically you have the password and all those things, you basically know from another computer.
Oh, okay. What
sites
sites they're getting on. Okay. Okay.
That's a tremendously helpful.
Yes. So like I was saying, monitoring. What sites are they getting on? You really need to follow that and make sure that they're not getting on to dangerous sites. Teenagers, your teenage years, that's the time to explore and investigate and learn about new things, and the temptations are very, very easy to fall into. Any other questions? Okay.
For the last one, I'm sorry. I said, inshallah, we're gonna make another time for the kind inside the house. I realized all the safety stuff here for the life.
Yes.
But if not a danger life, but danger in the character and the
sure.
manner and the attitude, or sometimes our culture and this is the reaction, like the father when he asked his son, روح اشتري لي ابني معسل, or give me the cigarette, or give me the beer from the refrigerator. This stuff, inshallah, we focus next time.
Sure.
Jazakallah khair.
Inshallah. وإياكم. جزاكم الله خير.
Thank you very much.
جزاكم الله خير. السلام عليكم ورحمة الله وبركاته.
I look, I see. I see a world of beauty. I touch, I feel. I feel the world around so real. And everything I do, I dedicate to you. 'Cause you made me, I am for you. I listen, I hear. I hear the words of God so clear. I read